So I mentioned before I'm going to talk about Flex Health, which is a product which is actually a breakthrough in musculoskeletal health, and I'll explain why that is. And we're a small startup based in the C4DI in Hull, and we're working with Arco, who people will realise are a local seller of personal protective equipment. And the reason we're partnering with them is because they want to do things that are more digital, and we want a route to market, and they sell to lots of big customers, and hopefully we can make Flex a success through that. So I'm going to explain what Flex is. Fundamentally, Flex is about keeping businesses active. So it's about protecting the employees' musculoskeletal health. So I'm just going to talk a little bit about the science of musculoskeletal health to give the background here. Our bodies are actually incredibly complex machines, and we've evolved over thousands, if not millions of years, to do incredible tasks. The problem is today, what we're evolved to do, we don't do. So we're evolved to fight, hunt, gather, and effectively have quite an active life. But what we do today is we get food from Just Eat, we drive around in cars, and we sit at desks all day. And that causes lots of musculoskeletal problems because our bodies are adapted to do lots more activity than we do today. And because we underuse that, that's a problem. Even the things that we do to stay active often cause musculoskeletal problems because they involve repetitive movements. So if you cycle or run, that's great for your cardiovascular system, but it's often bad for your musculoskeletal system because it can damage muscles and joints and the nerves that control our body. And if we look at this from a macro health point of view, and this is data from the World Health Organization, which is measuring years lost to disability. A year lost to disability is a year of someone's life which is adversely affected by some form of disease or illness. And the World Health Organization used this measure to track what the global health problems are. And what's interesting from our point of view is 3 of the top 10 conditions are actually musculoskeletal health problems. And as a result, 149 million years are lost to disability every year. That costs healthcare systems lots and lots of money. In the US, it equates to £100 billion a year, and globally that figure's much, much higher. But it also, that musculoskeletal disease also impairs our health in more general terms, because staying active and being physically active is really good for your metabolic health, your cardiovascular health. It's even good for your hair, even though I'm not a good example of that. It's good for your skin. It's good for everything. So if we have poor musculoskeletal health, it causes us pain, but it also affects every aspect of our health. So in other words, musculoskeletal health is really, really important. And that's why we've developed a product that we call Flex, FLX, Flex, pronounced Flex. And basically Flex is an app, and it uses cutting-edge biomechanical science to basically prevent musculoskeletal disease, treat any pain that people have, and also to support healthy movement. And I'll explain what that means as we go through. So in our organisation, we have a guy called Martin Haynes, who's a world leader in the science of biomechanics. And he's the guy who developed the algorithms that sit inside our product. And they were developed over a period of 15 years in 4,000 patients. And we've created what we call an intrinsic biomechanics model. And what that means in lay terms is we can understand what's going on inside your body and the complex relationship between our osseous, neural, and myofascial systems and our genetics. In other words, our muscles, our bones, and our nerves, and how they interact to keep us fit and healthy in terms of musculoskeletal disease. And what we see with biomechanical problems is everybody has biomechanical dysfunction, and if left untreated, that biomechanical dysfunction will lead to musculoskeletal pain and potentially musculoskeletal disease in the future. And our product understands this relationship and allows us to deal with biomechanical dysfunctions to improve overall musculoskeletal health. Like any Flex is actually a medical device, so it's a regulated product, so we have to have a lot of evidence to say that it's safe and effective. Our product is actually clinically proven in clinical trials, and we've had over 4,000 people in those clinical studies. The algorithms themselves were developed among 4,000 subjects, and then we went on to prove those algorithms in a real-world setting. And this slide shows the clinical studies that we've done. We've effectively done 5 clinical studies that prove that the product works. And I'm going to share some of that data in the next slides. So the first key study we did was in the South Yorkshire Police Force, where we deployed the app among 237 police workers, and we were able to show a reduction in musculoskeletal disease of 64%. So 64% is a big number, and general medicine and taking vitamins doesn't do anything like as much of a benefit as our products has been able to show in this particular study. And this gives us a claim to say that we're able to help prevent musculoskeletal disease. We kind of repeated this study. It was a little bit different, but we did it in the Dorset Fire Brigade, and we looked at back pain as the key endpoint in this study. And again, we put the app in place in the fire brigade. In this case, we ran it for 3 consecutive quarters. And what we were able to show in the Dorset firefighters who participated in the study, we showed a 52% reduction in absenteeism due to back pain. Back pain is a big problem among fire brigade people, because obviously they've got to have a highly physical job, and it causes lots of back problems. So we were interested in back pain. Again, this data shows that we're able to reduce the risk of musculoskeletal disease and injury. So I mentioned that the product can do 3 things. The first thing is prevent musculoskeletal disease and injury. I've shown the data we have for that. The second thing the product can do is treat pain. So we've done studies in pain. And this study is a study we ran in a health club setting, where we basically looked at people attending a health club and looked at the pains they were suffering from. And in this study, the people had shoulder, back, knee, foot and ankle pain. And they did our pain program. And over a period of 6 weeks, we were able to reduce that pain by the figures that you can see in this chart here. So ranging from 25% with shoulder pain up to 75% with knee pain. So even the 25% reduction in pain might not sound like a big number, but if you were to do a clinical study and you achieved a 10% reduction in pain, that would be considered to be clinically relevant. So all of these data are highly clinically relevant, and obviously means something to the patient in terms of the pain relief they've received. We've also done a pain study of the NHS in Great Yarmouth and Waveney. And in this study, we looked at people who had chronic pain, and we categorised their pain according to the level of pain they were suffering from. So they were either categorised as having no pain, mild pain, moderate pain, or severe pain. And we put them through a 3-month intervention with our products. And what we were able to show is after 3 months, there were fewer patients in the severe pain categories and the moderate pain categories, and more patients in the mild and no pain categories. So in other words, we were able to treat this block of people and reduce the number of people suffering from severe and moderate pain, and move them into categories which were very low levels of pain, which again shows us that we can help with the app to manage pain. What was interesting in this particular study is that musculoskeletal pain, I mentioned earlier, costs the healthcare system lots and lots of money. The people who ran this study in the NHS in Great Yarmouth were estimated that for every £1 spent on the intervention actually saved them £16 in terms of what they would normally do in treating musculoskeletal disease. So obviously if you're referring patients to see a physiotherapist, that's quite a costly endeavour, because those physiotherapists have to be paid. Physiotherapy sessions usually take 3 or 4 treatments to resolve an issue, and we're able to do that digitally, which takes that cost out entirely, except for the cost of the app, of course. Finally, I mentioned that we can reduce the risk of pain, reduce the risk and incidence of musculoskeletal disease and injury. We can reduce pain, but also importantly, we can help people move more freely. And we've done studies of how people move with the app. And after using the app, we were able to show improvements in flexibility, improvements of range of motion, and improvements in people's function. And we're able to improve their function with using 12 weeks of the app by the percentages you can see there. So we increased flexibility by 149%, mobility by 42%, and function by 95%. So it's a really important aspect of musculoskeletal health. It's not just the pain you have, it's also how freely you can move, and how that allows you to be able to achieve more and do more things. So that's kind of like the theory and the data that we've generated, which is all very interesting and scientific, but it doesn't necessarily mean that much to people. So what I'm going to show you here are a couple of case studies. So the first person here is actually a young girl who had knee pain. So she presented with knee pain and she went to see a doctor. The doctor could find nothing wrong with her, and medically she was cleared, but she had knee pain. When she ran, she had knee pain. And what we were able to show with our app, looking at her biomechanics, is she actually had a left leg length discrepancy. I said that slowly because it's quite hard to say. A left leg length discrepancy. As you can see from this photo, her left ankle is a couple of centimetres below her right ankle. Our app was able to identify this biomechanical dysfunction. If you just click on the picture, please, it'll advance to the next photo. Thank you. As you can see here, because she had a slightly longer left leg, she was actually compensating for that by effectively bending her left knee. And that was the problem that was causing her pain. If you just click to the next slide, please. There's another, sorry, you click on that photo. What we were able to do with the app identified the biomechanical function. We gave her the exercise program. And in this particular case, through our exercises, within 7 days, we were able to restore her pelvic function and rectify her left leg length discrepancy. And as you can see in this photo, she's no longer bending her left leg, and she had healthy biomechanics. And she was back running within 7 days after having a very, very long period of months and weeks and months talking to the NHS about what was wrong with her. If you just click to the next slide, please. I'm going to give you another case study. In this particular case study, this girl is actually a British champion rower at the underage. Well, she was under 18 when this data was taken. And if you just, so she's an elite rower, but what she was finding is that she had problems with her legs. If you just click on the picture, it'll play a video. Sorry, yeah, thank you. So what you can see when she's rowing, I'm not an expert rower, and maybe there are some rowers in the room, but what you can see when she's rowing is actually her left leg is bending out to the side. And that was causing a muscle spasm in her hip and causing scoliosis, which is twisting of the spine, and it was causing a loading in her left knee. So this was causing her a big problem. In terms of rowing, we're looking for marginal gains, and she was obviously an elite athlete. So she wanted to address this to get the maximum power in her stroke. So if you just click to the next slide, there's another video with her after. So it's on the next slide, sorry. Yeah, click on that video, please. So what we were able to do with the app is we were able to identify the biomechanical dysfunction that was causing her left knee problem, and we were able to intervene with the app and restore her to normal function. And as you can see in this particular video, she's rowing and both her legs are nice and parallel and straight. Now, I'd love to be able to tell you she went on to win a gold medal, and she may have done, I just don't know if she did or not, but I should research that. But anyway, we were able to restore her function to get her back rowing properly. If you just click the next slide, please. So really, I've explained what the app does from a user point of view. Our business model is doing this as a corporate wellbeing platform, so we're engaging with employers who want to look after the health of their staff. If you're off ill from work, it's generally, there are two causes of that, or two leading causes of that. It's either mental health or stress, or it's musculoskeletal disease. And depending on which sector you work in, one of those will be number one or number two. And we tend to think about musculoskeletal disease as being a problem for heavy industry, farming, fisheries, agriculture, but it is a problem in those sectors, obviously, but it's also a problem in more sedentary sectors. So being sedentary and having a sedentary job is really toxic for your musculoskeletal system, because we're sat around, we're not exercising on our body in a natural way that it was evolved to move, and that causes musculoskeletal systems, as I mentioned. So, as I said, we're trying to develop this product and sell it to corporate clients as a wellbeing platform, and an employer who cares about their staff and wants to reduce absenteeism would benefit from the reduction in musculoskeletal disease that we can achieve, but we can also generate a dashboard for them. So all of the data that's collected in the back end can be shown to the employer, and that is anonymized, so obviously this is health data, so it's confidential. But what it shows them at a macro level is what's going on in my organisation, so we can see how many people are off, what kind of problems they're suffering from. So it gives us a way of monitoring the success of the app but it also gives them a way of monitoring what's going on in certain operations in their organisation. So if they have a certain type of person doing a certain type of operation and they're seeing a high incidence of shoulder pain, for example, then that gives them a signal to go into that operation and figure out what's going on and change working practices to address that. And I'm going to finish the presentation with a short video which basically recaps what I've just said, but it also explains why we're working with Arco. So as I said, we've just partnered with Arco, and I'm just going to play out with this video, which is about 2 minutes. So if you wouldn't mind just clicking to the next slide, and I could have done that, couldn't I? Sorry.
Musculoskeletal disorders are a major health issue and can have a debilitating impact on sufferers' lives. They affect 14.9 million people nationally.
Musculoskeletal disorders, or MSDs, can have a life-changing effect on the health and well-being of employees, and an adverse effect on the commercial performance of businesses too. In 2018, 28 million working days were lost due to MSDs in the UK alone. As experts in safety, we're always looking for ways to keep people safe at work and want to support employers in reducing the risk of work-related issues like MSDs. That's why we're excited to bring to market an innovative physiotherapy app called FLX. It's been specifically developed to help keep employees and businesses active. It provides self-management exercise programs designed to help people suffering from musculoskeletal pain and help prevent issues developing in the first place, including for those that work in occupations with higher occurrences of MSDs. The real benefit is that these exercises can be done anywhere, at home or work, or added into your regular exercise routine.
Regular exercises to improve the way the body moves have been proven to improve musculoskeletal health, things such as strength, mobility, and flexibility. The FLX app exercise programs were developed in specialist biomechanics labs, elite training facilities like this one, and working with more sedentary people in physiotherapy clinics. The FLX app is unique in the fact that it creates a personalised experience for each user and responds to suit their progress over time. FLX empowers employees to take responsibility for their own health. It does all of this without the need for a face-to-face or online consultation with a physiotherapist. Our bodies are amazing machines, but we're using them less and less. And our modern lifestyles and working environments are changing faster than our bodies can adapt. There are over 200 musculoskeletal conditions which can affect bones, tendons and muscles in all parts of the body. These problems are often caused by work-related activities like manual handling or heavy lifting, working in awkward or tiring positions, and repetitive keyboard work. Informed by research into MSDs involving over 4,500 people over a 15-year period, the FLX app is based on algorithms proven in a real-world clinical setting.
The FLX app has already been proven to make an active difference with impressive results.
The FLX app was trialled by the South Yorkshire Police Force with 237 of its workers. The results were remarkable. MSDs were reduced by 64% over a 12-week period. Absenteeism dropped from 43 to 18 days a month, and budget savings of £65,000 a year were achieved for rolling out the app.
A healthy workforce is a happy and productive workforce. The FLX app allows businesses to take an active approach to their employees' musculoskeletal health.
Contact Arco today about keeping your business active with FLX.
So if you're interested in musculoskeletal health, and you should be, come and have a chat to us. We've got a stand down there. We'd love to chat to anyone who wants to talk about it. Thank you. Cheers.